Look, this is the place I'd most like to be in the world. Family may be accepted. Being at this forum every year is such a privilege, an amazing experience. And I just want to thank all of you, the participants, for making it what it is, and the faculty. Could I get a shout out to the students? The students have been absolutely amazing. There are a lot of patients here, patients' families. You've contributed a lot, and I appreciate your being here, all of you. And of course, from my vantage point, the blue shirts are a treasure for this country, having this. I've had to change my speech a little bit after Brian Stevenson's talk. I want to reflect on that a minute. I want to also reflect on Derek's comments on mutuality. Derek and I did not compare notes in preparing our speeches here, only minimally so. It is quite remarkable. You're going to see how convergent where Derek's mind has gone, and mine also as I get deeper into this. But I also want to give a personal thanks to Derek. To be a former CEO in an organization, be as embraced and welcomed, is an extremely unusual thing, and so valuable to me. And Derek, I just thank you for your generosity to me and being. Brian Stevenson threw me a curveball. In his towering lecture, he confronted us with a travesty, the American criminal justice system. It's a health travesty, and it's doing immense harm. It's doing it with selective effect on people of color, poor people, excluded people. As we are now, we will either actively support it or through silence concede to it, and I don't think either of those is acceptable. So I cannot help wondering, and I'll get back to this. In fact, I can't help proposing that if we in the Healing Enterprises could possibly take on that challenge, stop the conceding, stop the concession, birth a system whose hallmark isn't blame, isn't silence, isn't abuse, but is rather compassion and anticipation and healing and justice itself. I'm sure you're thinking too hard, not our job, not our job. Can we think again, please? I want to talk this year about ending that harm. And if we can't end it in the nation, then let's begin in your state or your city. And as it happens, the talk I did prepare is relevant. This talk is a heresy, and I'm going to start with the punchline. The punchline is that competition is not the answer, it is the problem. We are in trouble. Healthcare is not meeting the social need. We are not accomplishing the triple aim. And we will not do that as long as we bet on competition as the remedy. Competition is not the answer. Cooperation is the answer. And if that is so, we are going to have to learn to act and think in fundamentally different ways. And the good news is we can. In fact, sometimes we have, and I'm going to show that to you. But first, listen to this. It's hard to hear. Listen. You hear a little ping in there behind the background noise. Could you play it one more time so people can hear it? $1.3 billion years ago, long before there was any trace of life on Earth, two black holes collided with inconceivable force. The collision generated a gravitational wave. That wave traveled for 1.3 billion years across time and space toward Earth. And on September 14th, 2015, at 5:51 in the morning Eastern Time, it reached us. And that chirp you just heard is the representation of that event. Albert Einstein posited the existence of gravitational waves in his general theory of relativity. That was in 1916. Ever since then, scientists for 100 years have wanted to detect gravitational waves, in part to prove Einstein's theory. But there's a problem, and the problem is that gravitational waves are incredibly hard to detect. They are incredibly weak. When that wave from that black hole collision 1.3 billion years ago reached the Earth, it bent space, just like Einstein said it would do so. But it bent space by only 1 part in 1 sextillion. That's 10 to the minus 21st power. That is small. A 1 meter stick on Earth hit by that gravitational wave, that stick lengthens by 1/1,000,000th of the diameter of a single proton. When that gravitational wave hits our solar system, the distance between the Earth and the Sun, 93 million miles, changes by the diameter of 1 single atom. The distance between us and the closest star system, Alpha Centauri, is 26 trillion miles. That distance changes when the gravitational wave comes between us by the width of 1 single human hair. That's what we were listening for. So tiny. But we heard it. The we here is the Laser Interferometer Gravitational Wave Observatory, LIGO, and the LIGO Scientific Collaborative. The LIGO interferometers, the detectors, are in Livingston, Louisiana, and Hanford, Washington. They have arms 4 kilometers long. They contain mirrors that guide laser beams precisely. They're protected by the most complex and complete shock absorbers ever fashioned. They guide the signal to detectors that are so sensitive that they can measure deviations 1/1000th the diameter of a proton. For detecting gravitational waves, 3 scientists won the Nobel Prize in 2017 in physics. Professor Ray Weiss from MIT, and Barry Barish and Kip Thorne from Caltech. These guys are smart, but they did not do this alone. An enormous team did it. LIGO, along with its European cousin called Virgo, it's a collaboration of over 1,500 scientists in 19 countries, in over 100 observatories, and they are linked together in one single unified global endeavor. Some of the labs built the mirrors, some built the vibration absorbers, some made the detectors or the lasers, some collected the calculations, calculated the data, others did the calculations on terabytes of data, and on and on. In order to hear that tiny, tiny signal, the entire Earth, the whole planet, had to listen together. There was no other way. All together or not at all. How on earth did they do that? How could scientists and engineers and astronomers and governments from so many nations possibly come together to get that job done as one unified global team? I called the scientists to ask them, how did you do that? Professor Barish, the Nobelist, Professor David Reitze, he's the head of LIGO. I met with Professor David Schumacher at MIT, the leader of the LIGO Collaborative. And I'll tell you what they said, but not quite yet, because first I want to tell you about my youngest brother, David. When David was born, I was 10 years old. I still can remember this wave of welcome that swept over our rural Connecticut family on the day that David came home, newborn from the hospital. It was one of the best days of our family's life ever. In March of this year, David almost died. At first, it was just a fever, but in a few hours, it was a raging case of sepsis from Legionnaire's disease. Organ by organ, David's body failed. low blood pressure, lung failure, kidney failure, delirium. They rushed him into the intensive care unit, and there modern medicine took over the functions of his failing organs, organ by organ. Here, 2 days into his illness, is David in the ICU. He is on life support. He's in coma. A ventilator machine is breathing for him, adjusting oxygen, respiratory rate, tidal volumes, peak pressures, end pressures, humidity. A bedside dialysis machine is replacing his shutdown kidneys, clearing poisons, waste products. A half dozen intravenous lines are feeding him. They're sedating him. They're dripping in antibiotics. They're maintaining his fluids and his acid-base balance. His bed has an oscillating mattress to prevent bed sores, a scale to weigh him, a cooling circuit to adjust his body temperature. An arterial line is measuring his blood pressure. And monitors in the room and remotely at the nurse's station are standing watch. 12 computer screens display his medical records, his lab reports, his vital signs, x-rays, CT scans. We were sure we would lose David. Death rates from adult respiratory distress syndrome are very high. They're high also from acute renal failure, and they're high from overwhelming sepsis. You put them all together, the odds are very long. The odds are nearly hopeless. The lowest points came on days 5 or 6. Each machine was being driven to its limits, to David's limits. We waited for the moment when there was no more room to push in oxygen, no more reserve in his heart muscle, no more hope that his kidneys would return. But then, little by little, the graphs started to change. The lines turned upward. More oxygen was getting through. Small amounts of urine appeared, and upwards, and David started to come back to us. On the 9th day, they pulled out his breathing tube. They lowered his sedatives, and David opened his eyes, and he asked how his cat was. On the 11th day, he left the ICU. On the 20th day, he went to rehab. On the 40th day, David went home. 3 weeks later, he went back to work, and on his 61st birthday, 3 months from his first day in the ICU, David had a lobster roll. He beat the odds. How? How did that happen? It's like a gravitational wave. Centuries of progress in technical medicine. They traveled through space and time, and they converged in a single place at a single time to surround my dying brother and save his life. How? Well, the machinery mattered. Each device had a history, decades, maybe a century of innovation after innovation harvested from an enormous partnership of science and government and entrepreneurs and professionalism. If those machines and those drugs could speak, they would recite an epic, trial, failure, progress, year after year, and all converging at David's bedside, waiting for him. They were waiting there to help him in March of 2017. But of course, the machines are only part of the story. They're the lesser part of the story. The greater were the people. I never counted David's care team exactly, but they were dozens. I would not be surprised if they were 100 or more. Most of those people we never met. They were in the back offices in the hospital, in the laboratories, in the stocking rooms, in the pharmacy, in the computer suites. They were upstream in the supply chain, in the universities. They were long gone in the teams of architects and engineers and workmen who built the spaces that held us. The local team, the team that was visible to us, was maybe 20 or 30 people. The doctors and nurses and pharmacists and technicians, they were ever present at David's bedside. They were adjusting things. They were speaking with each other. They were thinking with each other. They were speaking with us, David's loved ones. They were thinking with us. This was a ballet more complex than any dancer ever danced. Most impressive of all was the care team. Several times, every single day, the whole team huddled just outside David's room. They were around computer screens and paper charts, protocols, checklists. Methodically, really religiously, they worked their way down the list of David's battles: renal function, lung function, infection status, fluid status, sedation, pain control, mental status, nutrition, electrolytes, diabetes, more and more. And at every mental station on that thought journey, they paused. They collected what was known, they talked, they asked questions, they set new plans, and they learned and they learned. Amazingly, movingly, they included David's family in all of that. They included me. Any questions they would ask, and then any ideas. We, the people who loved David, we were not watching the team. We were on the team. And I noticed everybody had a voice, just like we did. Sure, the ICU director, he had a voice, but so did the student nurse, so did the ventilator technician. Once I saw the ventilator technician politely, but very directly challenge his boss, the senior supervising resident. He thought the resident had made a mistake, and he spoke up. "That's not right," said the technician. And the doctor said, "Thank you. Maybe I'm wrong." I could go on. I have focused on quality in healthcare for 4 decades now, and my attention has so often been on what is wrong, what's unfinished. But in this unwelcome chapter in David's life and my life, I got to see the care that I dream of. This, I will tell you, was at Boston's Beth Israel Hospital Deaconess Medical Center. How do you thank somebody for your brother's life? Because of that, David had a lobster roll on a birthday that we thought he'd never see. David's story and the story of detecting gravitational waves are worlds apart, aren't they? But think again. These are both victories against nearly impossible odds. They're both stories about intense, shared aims. The scientists of LIGO and the people on David's ICU team, they knew exactly what they were trying to do, and they cared deeply to do this. These stories are also both about humility, an imposed humility, the type Derek was talking about. Humility in that every single actor knew without the shadow of a doubt that separately he or she would fail. The only way to get the goal was to get there together. No one physician, no one nurse, no matter how clever, how heroic, how self-sacrificing, how ambitious, could possibly have gotten my brother through his storm. It took everyone. And the glue was purpose. It was all together or not at all. There's an interesting book called Super Cooperators by Martin Nowak, who's a Harvard professor of biology and mathematics. He explores in this book how cooperation comes to emerge in biologic and human systems. I envision Derek's slide of the anemone and the clownfish. He quotes Bertrand Russell. Russell said, "The only thing that will redeem mankind is cooperation." The subtitle of Nowak's book sort of gives away his punchline. The subtitle is Altruism, Evolution, and Why We Need Each Other to Succeed. He writes, "If you're a cooperator, you will find yourself surrounded by other cooperators, so that what you reap is what you sow. To succeed in life, you need to work together, pursuing the snuggle for existence, if you like, just as much as you strive to win the struggle for existence. Cooperation," he says, "not competition, underpins innovation." I think that's an interesting premise, that what detected gravitational waves, what saved my brother, was the snuggle for existence. Cooperating like that at large scale isn't foreign to healthcare. We do snuggle sometimes, and I'm going to give you a few examples in the room. About 15 years ago, IHI was deep into a national project called Pursuing Perfection. The Institute of Medicine had published the Crossing the Quality Chasm report with its 6 aims for improvement: safety, effectiveness, patient-centeredness, timeliness, efficiency, and equity. And with the support of the Robert Wood Johnson Foundation, IHI was working with 7 US organizations to make the vision of that report a reality. Most of the players took perfection as a metaphor, but Dr. Ed Coffey and his colleagues in the Behavioral Health Division at Henry Ford Health System took it quite literally. They decided to end suicides, to achieve 0 suicides in a very high-risk population of chronically ill patients. And funny thing, they did it. In 2 years, the suicide rate went to 0, perfection. And that was at the time when the suicide rate in the general population was actually increasing. They didn't stop there. Ed Coffey, with his son Justin, who you saw in that picture, and who's in the room. Justin, want to stand up for a minute? Justin was a newly minted psychiatrist. They began to study their breakthrough and to spread it. First, they went to general medical settings and then across the country. The US Surgeon General and SAMHSA endorsed the goal of 0 suicides, and this momentum now is spread across the globe. Justin and his dad helped found the Zero Suicide Collaborative that now involves 12 organizations in 15 countries in the US and the UK, the Netherlands, New Zealand, Australia, Canada, Spain. It's a global movement now, and the 4th International Summit on Zero Suicides is going to meet in Amsterdam next September. The Ohio Perinatal Quality Collaborative is another example. Ohio ranks among the worst states in the country for disparities in perinatal mortality, but that's changing. An ongoing collaborative, which included all but 2 of the 110 maternity hospitals in the state, managed to reduce elective deliveries by 75%. It's now been working on proper use of progesterone. This is the entire state to prevent preterm birth with stunning results. Just like gravitational wave detection, the only route to success has been system-level cooperation among people who normally might not. Clinicians, practices, Medicaid, the health department, state officials, payers, patients, community groups, all together. It took Dr. Mary Applegate. Dr. Applegate's here. You want to stand up, Mary? Along with a lot of colleagues. Mary's the Medicaid director at Ohio Medicaid. Jay Iams, a senior obstetrician at Ohio State. Carol Lannon at Cincinnati Children's Hospital. Colleagues across the state, building trust, removing obstacles, sharing data and action, all together, or not at all. I had the pleasure of speaking just earlier this week with Dr. Ty Reedhead regarding the work of the Indian Health Service to care for American Indians and Alaska Natives who have diabetes. Dr. Reedhead told me about the work of the tribes and the health service, who historically have the highest diabetes prevalence among any racial or ethnic group in the United States. Ty, could you just stand up so people can see you here? Because of that work, the incidence of end-stage renal disease in people with diabetes in this population has decreased substantially since 1996. Look, it's crossed the status of almost all the ethnic groups listed. How has that happened? The decline followed the implementation by the Indian Health Service of public health and population management approaches to diabetes with improvements in clinical care. It required an entire national system, a national effort, involving patient educators, community health representatives, public health nurses, primary care teams with engaged nurses, pharmacists, dietitians, plus administrative, and of course, the tribal leaders themselves, all together, or not at all. Dr. Jennifer Walthall is the Administrator of Family and Social Services in the state of Indiana. She's effectively the Indiana Health and Human Services Secretary. In January of 2015, she got an unwelcome call. A cluster of HIV cases had appeared in a rural county, Scott County, Indiana, and it soon blossomed into a full-fledged outbreak, 181 HIV patients by November 2015 at a population of fewer than 15,000 people. The majority were in the town of Austin, Indiana, which only has 4,200 people. This was a public health emergency, and chaos was an option. But what happened next and over the next year was really amazing. Working with virtually the entire community of Scott County, Dr. Walthall turned an impending disaster into nothing less than a wholesale redesign of the public health systems of the county. And I want you to hear the story from Dr. Walthall herself. She's here with me, and I thought it might be best if she could tell the story. So thanks for joining us, Jen. I really appreciate it.
Thank you so much for having me.
I wish I could give you the whole hour, but let's take some time. First, tell the story. What happened? What happened in Scott County, and how did it play out?
So I had just barely found my parking spot at the State Department of Health back in early 2015, was the deputy health commissioner there. And we were sitting in one of our afternoon meetings, and one of the individuals who is the head of HIV services for the state said, we need to talk for a minute. We have reports of a cluster of 11 HIV cases in a county where we've never had any. And business as usual is to go take a disease intervention specialist to the county and find out what's happening with that cluster. And they said, we found something that's really unusual. In a rural community, there is generational use of needle sharing to inject a prescription opiate. The prescription name Opana, oxymorphone is the generic. So individuals coming together, sharing this drug with needles, and 100% of these cases were due to injection drug use. We'd never seen anything like that before. And it was so unusual that we realized very quickly that business as usual couldn't be the answer to this approach. And that really, one of the things that I said as I was looking at the spider map of how these cases were spreading is I said, this is a tornado. And it was that moment of realizing that we were not looking at a chronic disease of HIV and substance use disorder. We were looking at something that was really more of a natural disaster like pandemic flu or a tornado. And so the response that we chose was one that looked more like a natural disaster response. We went to Scott County as an entire state. We called the CDC to come help us. We called disease intervention specialists from 10 states to come help us, and we set up shop in a town, and we integrated into that space because as we had to respond with novel programs, we were building the evidence as we went. We also had to build capacity at the same time because we knew that this town needed to have something left when we left. And so what we found was that a community came together around what should have been our state's greatest tragedy and used that tragedy to build a new infrastructure in the way that we think about prevention and responses like this. We also never wanted it to happen to anyone else. We wanted to make sure that what we did was documented and sung from the rooftops so that others wouldn't have to do what we did.
So you started with an event and you built a system that's now durable, it's there, the capacity has stayed?
Absolutely. So what this looks like in Scott County now is every Wednesday, the one-stop shop opens. And when you walk in the door, every program that you need is available to you in one space. Really overcoming the barriers that our rural communities needed for a long time, and they need them no less now, even though we're not in the middle of an outbreak. Overcoming those barriers, transportation, housing, food, healthcare, mental health, addiction treatment, immunizations, they need those still, and not only Scott County, but the rest of our state as well.
So CDC, the state, the local health officials, local law enforcement, yourself in your job in the state government, clinicians, patients, people who I assume don't always get along together all that well, come together, not just to solve a problem, but to build something completely new. What's the glue? What keep that? Why were they together?
Well, first of all, I think we didn't realize that failure was an option. when we realized what was going on, there's a Hoosier spirit that I think has probably been talked about, but it's a real thing. We actually care about each other, and coming to a small town Indiana, I grew up in small town Indiana myself, and these were my parents and my grandparents and my sisters and brothers living in a small town and doing their best, and struck by a tragedy that wasn't their problem. It was mine. It was mine to help solve, and it was mine to prevent happening in the future. And so the glue really was love. I hate to sound corny, but I ended up being the spokesperson for the media, and I always wanted to make sure that I had Chief Spicer standing next to me. Chief Spicer is a little bit grumpy, but I love that guy. And I told him, I said, I'll do all the talking to all the reporters if you stand right here. And that really signified the relationships that we built and the relationships that are possible if we don't stay in our own lanes. Just because I'm an ER doc doesn't mean that I can't build solutions in the jail system with the sheriff, or think about how the hospital might do universal HIV screening in its emergency department, or how we might provide a phone tree for the local churches to drive individuals all over the state for treatment beds when they open up.
Any individual stories occur to you that you want people to go home remembering from this
Well, I have hundreds, but I think there are two that really stand out and still help drive the way that we try to design programs in Indiana. The first would be a young man who came to the one-stop shop when it was a 7-day-a-week, 12-hour day in a big warehouse in the middle of Austin. And he came to me and said, hey, Doc, I just wanted you to know something. I said, what's that? And he said, I just wanted you to know that HIV saved my life. And at first I thought, what a horrible thing to say. What a horrible statement that you would have to have a life-changing experience save your life. But then I realized what he meant, and it was that when he walked into the one-stop shop, he had actually been tested in one of our mobile clinics that was driving around doing testing house to house. And he tested positive in his own living room. And he thought he'd been handed a death sentence. But the tester said, no, come to the one-stop shop. It'll be open tomorrow morning, and we'll help you out. And he left the one-stop shop with a driver's license, a birth certificate, a healthcare insurance card, a doctor, an appointment for substance use disorder treatment the following day, all of his immunizations caught up, and an appointment with our workforce development folks who are also co-located with us. And I realized that he left with more than just those tangible things. He left with hope for something that was going to be better the next day. The second is a woman. I have the notoriety of actually being the first person to legally exchange a syringe in the state of Indiana. So, under executive order, we had an emergency stand-up of a syringe exchange program in Scott County for 60 days. It's now legal for the entire state, and we have 8 highly functioning syringe exchange programs across the rural state. That first day, we were trying to start something that we didn't know how to do, and we knew how to do it in Chicago and in New York and in San Francisco, and I'd talked to all of those people, and I thought I had it all figured out, and it turns out those things don't work in rural Indiana as well as you think they might. But standing and meeting and greeting our first patient, I said, what I'd love for you to do is just collect the syringes that you've been using and bring them and put them in this sharps box, and then we'll exchange clean ones for you so that your risk of things like HIV, she had just tested negative, hepatitis C, bacterial endocarditis, all of these complications, that you won't have to have those things. And then we can talk later about the other things, but let's start with this. And she wouldn't meet my eye. And after a little bit of talking, we finally made eye contact, and she said, you really want to help me? And I said, yeah, that's why we're here. We're here to help you, and we're here not just to help you today, but we are here to help you for the rest of your life, because we think you're worth it. And she came across the table and gave me the biggest hug. And it was in that moment that, again, we didn't know that we were supposed to fail, and I knew that we wouldn't.
So in rural Indiana, stressed and not wealthy, I'm sure, in a red state, in the midst of a crisis, you rebuilt a big, durable system. Brian Stevenson's challenging us to try to fix criminal justice. It's going to take a lot of work across boundaries. So just final word, what have you learned from this? If you can just think on your feet for a minute about advice, like how could we work together across boundaries that are so high, so impenetrable right now?
The word has to be humility. I remember learning when I was getting my master's in public health, which I did very late in my career because my residents were getting smarter than I am. Perking up in the middle of a lecture, because I was doing something else, as I often do, perking up when I heard the term cultural humility explained. And I always have been a little bit daunted by the idea of cultural competence. I'm never going to be competent in everyone's culture. It's just hard. But the idea of having cultural humility, that you acknowledge that we're not the same as all of the people around us, but that if we acknowledge that, we're willing to work at it, that you've already transcended the biggest barrier. And so that culture is not just what we look like or where we live, it's what we do and how we think about the world. And if we just have a little bit more cultural humility in how we approach problems, suddenly they're not problems anymore, they're opportunities.
Jen, thank you so much. I know how busy you are. I got a whole state to run. I really appreciate your coming up. Thanks, congratulations. I got so curious about the gravitational wave detection, I began talking with these scientists, and I asked LIGO's leader. They call the leader of LIGO is not called CEO, it's called spokesperson. It's Dr. David Schumacher, he's from MIT. I said, how did you do it? How did you detect gravitational waves? And his first answer was this. He just said, we had one single common goal. The scientists and managers all over the planet, all over Earth, they knew that there was no way anyone could get that job done separately. It was all together or not at all. The centers and people compete, sure, they compete for grants and money and fame and prizes, but everybody knew that no one of them could possibly alone assemble the skills or equipment or knowledge that it would take to detect a signal at one part in a sextillion. It did take a leader, people like Jen. Professor Schumacher said it was Professor Ray Weiss from MIT, who, along with Kip Thorne and Barry Barish, the Nobel Prize winners at Caltech, they provided role models, he said, as scientists. They were dedicated to their mission. They brought people together, especially young people, and they told the young people that they could be part of something much, much bigger than their individual selves. He said the leaders made a safe space. Dr. Schumacher said an absolutely supportive social environment in which informed by values. It was informed by a vision of what science should be. And he said, his words were generous in distributing honor. The LIGO Scientific Collaborative became a place where people could, without any fear, they could share their ideas, share their problems, come to feel allegiance to this overall endeavor. Their careers would thrive by joining others, not by defeating others. I find this tantalizing, that we can do it. Sometimes humans can cooperate at massive scales across time and space, across disciplines, across any boundary. We know we can do it because we have done it on the planet to find gravitational waves, among nations to end suicide, among communities to stop an HIV epidemic, in the ICU to save my brother's life. So if we can do it, what stops us? How does collaboration happen at large scale to solve problems that simply cannot be solved in any other way. What's the secret of snuggling? The stakes in getting an answer to that are enormous. Every year we gather at this forum, 29 years in a row now, to talk about this systemic patient, healthcare itself. It's not yet maybe on the brink, it's not yet in the ICU. But the symptoms of care the systems of care upon which our nation depend are showing ominous signs of stress and vulnerability. They're showing signs of impending failure, I fear, just like David's fever that morning. Our care is not fit for use. As we are now, we cannot handle the vast demographic shifts toward chronic illness and aging, even though we know how to do that. As we are now, we cannot make care safe, even though we know how to do that. We cannot make put prevention at the center in its rightful, its regal, its logical role. We can't improve the determinants of health, not health care, but housing and transport and clean air and water, economic security, health insurance security, respect for women, equity, justice, even though we know that those are the right things to do. Those, not gleaming hospitals, those are the midwives of thriving. And we don't have a plan to use what we know. As we are now, we can't stop the rapacious rise in costs, even though we know for sure, for a fact, that at least a third of what we spend is pure waste, $1 trillion a year in the US. We can't take full advantage as we are now of the magic of the digital age. As we are now, the triple aim is a pipe dream. And joy in work, the essential. Some would like it to be the added leg, the quadruple aim. It's out of reach. The designs we have inherited are not up to the job as we now are now. We fail. And to meet Brian Stevenson where he wants to bring us as we are now, not going to happen. We need a fundamentally different system. But the dominant approaches that we're using throughout the world to try to birth that system, that new system of health and health care and justice, won't work either. These methods can't work. The dominant approaches are not founded on science. They're founded on myths. Myths like this. Myths that the workforce isn't trying hard enough, that we have to lean on them harder to get the result. The myth that incentives are going to fix this, I do not believe that we can rig payment to force the changes. I don't think so. That regulations will fix it, that will tighten the controls, enforce the goals. Did you hear one word of that in Jen Walthal's story? That measurement is a primary driver. If you measure and report, then as Derek's slide said, a miracle happens. The myth that formal experiments are going to show us the way. That's not how learning happens, not in the world we're in. That more technologies will solve it, that just more stuff will get us there. And the myth that professionals if only the professionals could seize the controls, the plane would fly right. The myth that we can mandate spread, we know how to do it, so just yell, do it. That is not how we detected gravitational waves. What saved my brother David was none of those. Compare those stories to this bankrupt beliefs. Trying harder couldn't save David. Trying together could. In no way was payment for performance in the picture. The key motivators here were intrinsic. Individuals were doing what they deeply wanted to do. There were guidelines. That's what David's care team was reviewing in their religious ceremonies, in those huddles. But resilience, adaptation, innovation, not compliance, those were the mainstays. Measurement mattered, but not measurement for judgment, not measurement for incentive. It was measurement for learning and adjustment. That's what all those graphs and monitors were telling the team. Randomized trials, formal experiments, they were in the background for the devices and the drugs. But equally important, I think more important, were real-time, continuing local tests, adaptations. PDSA was the science. Parsimony, not excess, guided choices. David's team was continually looking for things to stop, They were ex-novators, in Maureen Bisignano's term. And professional domination deferred. It deferred to a sense of community, the humility that Jen talked about, a sense of community, a sense of shared knowledge. That's why a respiratory therapist, a technician, could correct a doctor when the doctor was wrong, and the doctor thanked him. I may be wrong, but I sense a vast weariness with the bankruptcy of win-lose plans. I sense a hunger for the snuggle for existence, and yet still win-lose strategies, they have a chokehold on American healthcare policy. The beliefs dominate that combat helps, that market competition is the ideal driver of excellence, that pursuing victory over each other will lead to victory over disease. That win-lose ethos, I must say, it's being nurtured today at the highest levels of our government, destroying our sense of solidarity and impairing our trust in compassion and caring as the essential fabric of a successful society. Jen Walthall apologized for using the word love. She needn't. The damage is inestimable. But so strongly held are these beliefs in the value and the inevitability of combat and competition and victory over other people that merely to question them can be cast as naive or disloyal to the American project, foreign. Well, I question them. In the past few months, I have gotten a chance to meet with stakeholder groups in cities and regions here and abroad, like the people Jen was talking about, in Rochester, New York, in Lincoln, Nebraska, from King County, Washington, from Kent in England, Buckinghamshire and Bournemouth in England, the Isle of Wight. And together in a room with people who care about their communities, from healthcare and business and civil society and organizations, patient groups, more, they all have the same question. They're asking, how can we cooperate more effectively to achieve the triple aim and to restore joy and pride in work? And I think that is the right question. Economists may laugh. I mean, if market forces and competition and survival of the fittest is your plan for the future, if it's how you understand the world, then snuggling is the last thing on your mind. It sounds naive. It's a setup, one fears, for exploitation and defection and disillusionment. The thieves win. But think again. Think back to the best time of your life, whenever it was. A time, I'm sure, it's when you gave yourself to an aim, when you celebrated interdependent relationship, much, much bigger than yourself. Maybe you weren't on David Schumacher's LIGO team or on David Berwick's ICU team, but surely you were on some team that mattered to you. And by the way, there was joy. Themes recur in these stories of success, in the snuggle for existence. Could they help us get to the triple aim? I don't know. It's a first draft. But if LIGO can work, if David can survive, maybe we can too. Here are some themes I think I see. Clear common purpose. The glue is aim. From story after story, the verses differ, but the chorus is always the same, and it's, we wanted this. Find the wave, eliminate suicide, stop AIDS, save David. The clarity of the goal, the ambition of aim, it kept people together. In fact, I'm starting to think the tougher the aim, the stronger the glue. That's my hypothesis. People want to pursue perfection. They want to try the impossible. You just have to give them a chance. Second, the aim isn't enough. In these stories, aim marries humility about the limits of heroism. You heard it from Derek and you heard it from Jen. This is what Marshall Gans and Kate Hilton and others call the story of self and the story of us. Every example of collaboration connects the dream of the individual with an awareness of the essentiality of shared action. It starts with self. I want this. But it goes on with community. And I cannot succeed alone. It's all together or not at all. Third, I think I hear a recurrent theme about a safe vessel. Every story that I hear, it involves a sanctuary. The tasks are very hard. You remember this? To sense a gravitational wave means detecting a distortion of space in the distance between the Earth and the Sun, 93 million miles, that is the size of the diameter of a single atom. To end suicide, to save David's life in the face of sepsis and kidney failure and lung failure, no sane person would actually set out on those journeys and expect success at every turn. Failures are inevitable. They're instructive. For the first 6 years of LIGO, 2005 to 2011, the number of gravitational wave events detected was exactly 0. But they didn't give up. The failure was their schoolhouse. Safety to fail, it's a precondition for success, I think. And the young physicist who hitches her wagon to the LIGO search among the stars, she needs to know that her career can thrive despite the bumps in the road. The young resident who's struggling against the odds to save David needs to know that it's okay to try. A fourth theme I think I hear is shared honor. One of my mentors was the late Professor Fred Mosteller at Harvard, and Fred once advised me this. He said, never forget that credit is infinitely divisible. You know, of course, people want the Nobel Prize, they want their names on key papers, but something about the sociology of large-scale success, it creates an ethos of win-win. It's a sense of celebration that is not owned, but it's shared. David Schumacher said of LIGO, he said, it's a place where people watch out for other people's careers. He called it shared honor, and I like that term. Fifth, affection and mutuality, to use Derek's term. From outside in, the tools are very blunt. We call them accountability, incentive, surveillance, contingency, but not one of the success stories of large-scale collaboration headlines any of that. The words are much softer. They're much truer. Affection, trust, loyalty, fun, and duty. Again, in this often vicious time in my country and on our planet, to call for love and affection as foundational for progress, it sounds hopeless and naive. It is not naive. It's an awakening to what really, really matters. And I swear to you, affection is the fuel and the bond that, in the presence of shared aim, energizes and holds together these immense and thrilling enterprises. It is what you could feel in this room. And of course, there is inevitably leadership. Every story has a trusted convener who uses fame or position or power or gravitas, Ray Weiss or Kip Thorne, but they're not using them as levers for control. They're using them as well springs of confidence and mutuality among those who don't have the fame or the position or the power. These mentors, they teach purpose, they teach generosity. They make spaces safe for the failures that open doors. They celebrate the young and the novel, and they remind everyone every time of the beauty and the value of the work. To win, they teach, to win, it is not necessary that others lose. It is necessary only to hear together the universe whisper the truth. You hear that sound? Listen. listen together. What does that sound? Is it two black holes merging 1 billion years ago? Two neutron stars becoming one, sending us a message that's almost too faint to be heard. Almost too faint, but not quite too faint. Heard if we listen together. Is it David's heartbeat, my brother's life, fading and fading, almost out of reach, almost gone, almost. David almost gone, but not quite. Able to come back if only we will call him back together. Is it, now I wonder, the sobbing of a young boy in prison or heading for prison who is now sure of only one true fact, and that fact is that he is alone, that no one is listening, out of reach, almost, but not quite out of reach, if we together hear him? Or is it the call of the care and the health and the healing community that we dream of, far, far away from the care and the health that we have now, light years away, almost out of reach, but not quite, if we together build it? Thank you.